Good morning. Um, a second healthcare worker at Texas Health Presbyterian Hospital has preliminarily tested positive for Ebola. These tests will be double confirmed by the CDC um, uh, in the next few minutes. Like Nina Pham, this is a heroic person. I'm sorry, I said like Nina Pham, this is a heroic person, a person who dedicated her life and is dedicating her life to helping others and is a servant leader.
Gloves, single gloves or double gloves. I mean, these questions are being looked at by a lot of other hospitals who are trying to decide how to protect their own staff. So it's really important to know exactly what they were wearing and what people can do.
So when we've reviewed the records for the first several days of the patient's stay before he was diagnosed, we see a lot of variability in the use of personal protective equipment. And when our team arrived the same day the patient was diagnosed, we noted, for example, that some healthcare workers were putting on 3 or 4 layers of protective equipment in the belief that this would be more protective. But other things were done, such as taping parts of the protective gear, again, in the belief that this would be more protective. And we certainly understand the fear and the anxiety that's normal and understandable. These are good, dedicated people who worried about themselves and their families, and they were trying to protect themselves better. But in fact, by putting on more layers of gloves or other protective clothing, it becomes much harder to put them on. It becomes much harder to take them off. And the risk of contamination during the process of taking these gloves off gets much higher. That's true for several different areas of the body. I think, more broadly, if I could comment, I know the issue of PPE has gotten a lot of focus. There are several right ways to do it. What we have always emphasized is that healthcare workers who are using familiar PPE in familiar ways are more likely to do it right. We're looking at this, we're working with the hospital, and we will absolutely look at what are the ways to provide the maximum possible support to healthcare workers and allow them to do their jobs by minimizing their risk of contamination. I don't know if Secretary Burwell would like to add anything.
No, thank you, Tom.
Next question, Holly.
Thank you. That comes from Kelly Giblum with the Bloomberg News. Your line is open.
Hi, thank you for taking my question. First of all, I was wondering which patient was going to be transferred from Emory and whether it was just one. Just want to clarify. And also, are there any other people who are healthcare workers who are among these that are currently being tested or are currently being isolated or at the hospital with Ebola symptoms?
Thank you. Can they confirm Senator Murphy?
Mr. Frieden, do you want to answer that, or would you like
Yes,
to?
So the second healthcare worker is the individual who's being transferred from Dallas to Emory, and we continue to assess anyone who has symptoms. We encourage people to come forward at the slightest concern. We have not currently identified anyone who we feel merits blood test to see if they have Ebola. We are continuing to monitor closely, and as with many parts of this investigation and this response, this can change from minute to minute and hour to hour.
Next question, Holly.
Thank you. That comes from Betsy McKay with the Wall Street Journal. Your line is open.
Yes, thanks very much. Just a couple quick questions. Did you say the first patient will be transferred elsewhere, and if so, could you give us a little more detail on that? And secondly, I wanted to go back to the movement of the healthcare workers. Dr. Frieden, you said you'll ensure that none of the others who are being monitored will be will be able to travel. What powers are in place for that to happen, and what exactly are the rules and the legal authority right now to prevent them from going anywhere or leaving home or whatever the level of quarantine is?
With regard to the first patient, the report from the hospital is that she is in improved condition today. We will assess each hour, each day, whether that's the best place for her or somewhere else might be. In terms of controlled movement, that's something that we work out with the state and local public health authorities.
Next question, Holly.
That comes from Janet St. James with WFAA-TV Dallas. Your line is open. Janet, please check your mute button. Your line is open.
Okay, Holly, let's go to the next question, please.
Thank you. One moment.
Holly, next question.
Yes, thank you. I apologize. One moment.
The demo?
Holly, do we have questions coming?
Yes, we do, sir. Just one moment. I apologize. Lavendera with CNN News, your line is open.
Dr. Frieden, two questions real quickly. Was there the protective gear that these healthcare workers were using, was there any skin exposed? Some of the video that I've seen of healthcare workers in other parts are fully covered. Were these workers fully covered, or were there parts that were exposed? And the second question is, did the hospital not tell any of these healthcare workers to limit their travel, to limit their exposure with the public before today?
So first, some of the forms of PPE used did allow exposure of some parts of the skin. We have discussed in detail, and there are right ways to do it, several different ways, including with exposure of some parts of the skin. The key is the adherence to protocol, and the problems that we have identified had to do with using PPE in unfamiliar ways. In terms of the travel, as I mentioned earlier, when the individual, the second healthcare worker, left for Ohio, the first healthcare worker had not been diagnosed. So all were under active monitoring, but all were under self-monitoring and were not being actively monitored, because at that point it was not known that there had been exposures in the care of the first patient. I do want to mention one thing, because I may not have said this earlier regarding the plane. The fact that the patient number 2 did not have a fever until the next day, did not have nausea or vomiting on the plane, or suggests to us that the risk to any around that individual on the plane would have been extremely low, but we are going and will always put in extra margins of safety, and therefore, as Secretary Burwell said, we'll be reaching out to all of the passengers and crew of that flight.
Next question, please, Holly.
Yes, that comes from Brittany Hughes with CNS News. Your line is open.
Thank you, and good afternoon. In a video message to countries in West Africa that are experiencing Ebola outbreaks, President Obama told residents that they cannot get the disease by sitting next to someone on a bus. But CDC recommendations state that travelers in West Africa who begin to show possible symptoms, or people who've experienced a high risk of exposure, should avoid public transportation, including buses. And we've also seen large amounts of concern shown regarding potentially infected people traveling on airplanes. My first question is, did the CDC vet this video message before it was released and posted on U.S. Embassy websites? And is it true that a person runs absolutely no risk of contracting Ebola on public transportation, such as a bus?
So, yes, CDC vetted the message, and yes, we believe it's accurate. I think there are two different parts of that equation. The first is, if you're a member of the traveling public and are healthy, should you be worried that you might have gotten it by sitting next to someone? And the answer is no. Second, if you are sick and you may have Ebola, should you get on a bus? And the answer to that is also no. You might become ill. You might have a problem that exposes someone around you. Because the risk is so low, we think there is an extremely low likelihood that anyone who traveled on this plane would have been exposed, but we're putting into place extra margins of safety, and that's why we're contacting everyone who was on that flight.
Next question, Holly. Holly, next question, please.
Yep, thank you. One moment.
All right, we should point out that we're continuing to listen to this live press conference that's happening right now in Atlanta from the CDC and the Director of Health, or the Secretary of Health and Human Services. You're listening to some Q&A that's happening right now. This is happening over the phone, so that's why you're hearing a couple of lulls in the conversation, but we'll return you back to it now.
That treated Mr. Duncan from, getting on public transportation.
So the treatment of both of the patients there is as per their treating physicians, and that information has to be from the hospital there. In terms of controlled movement, that's something that we work out with the state and local public health authorities. At this time, we require anyone who may have been exposed to travel by controlled movement only. The healthcare worker number 2, who traveled from Ohio on the 13th of October, Monday, should not have been allowed to travel by plane or any public transport by virtue of the fact that she was in an exposed group. And although she did not report any symptoms and she did not meet the fever threshold of 100.4, she did report at that time that she took her temperature and found it to be 99.5. So by both of those criteria, she should not have been on that plane. I don't think that changes the level of risk of people around her. She did not vomit, she was not bleeding, so the level of risk of people around her would be extremely low, but because of that extra margin of safety, we will be contacting them all.
Holly, we'll take 2 more questions, please.
Marsha Kadorva, your line is open. Please state your affiliation. Marsha, your line is open.
All right, Holly, we'll go to the next question, and we'll make that the last question, please.
Thank you. One moment for the next question. Alex Altman with Time Magazine, your line is open.
Thanks for doing this call. You've noted that a site manager, installing a site manager is a very important element of containing this virus. If that's the case, why was one not immediately installed in Dallas when Mr. Duncan was diagnosed?
That's certainly something we will make sure happens for any future case of Ebola in this country. I'll just maybe perhaps Secretary Burwell say 1 or 2 words, and then if you want to make any concluding remarks.
Please, Tom.
So just to recap, Ebola is hard to fight, but we know how to fight it and we know how to beat it. The situation changes every day. We're always going to be open with what we know and share more rather than less. We're going to put in an extra margin of safety to protect Americans. This second healthcare worker case is very concerning. Our thoughts are with the individual and the individual's family. The investigation is identifying additional healthcare workers who will be very closely monitored, and we are planning for the possibility of additional cases in the coming days. Secretary Burwell?
Thank you, Director Frieden. I would just close by saying that this is
circle back on the question about why the president's staying here in town today. I'm wondering, I know that you said that it was necessary to respond to the outbreak, but I'm wondering why that is, especially since not only with the Malaysian airline plane that went down, but everything from Ferguson to Egypt to the Fort Hood shooting, we've seen the president either maintain his political schedule or his vacation schedule.
Sure. Each of these situations we take on we consider on a case-by-case basis, as you would expect. In this situation, the president felt it was important to convene a meeting of the senior members of his administration who are responsible for responding to this particular incident. And so the president's convening that meeting this afternoon, and because the meeting was this afternoon, the president had to postpone the political travel that he had already planned.